I've been working at the Royal Children's Hospital for a long time, since 1993. And through that time, I've seen increasing demands on the hospital and our waiting lists grow for our services, particularly in general medicine, and also the number of children coming to emergency department. And what I realised after some time is that a lot of the kids that we see and look after there could probably be managed closer to home with their GP managing their care and directing their care with some support and input from a paediatrician.
Our approach has been to try and do a couple of things. So one is the CoConsult Model, where we sit with the GPs for an extended appointment and we work with them to assess the child together, come up with a management plan together. And then the other thing we've been doing is the case studies, where we get together with the GPs in the practice, we talk about common problems, one of them might present a case and we do some troubleshooting.
Seeing a colleague, a paediatrician, consult on that same child and having the privilege of sitting in on that consultation really kind of broadens your aspect of, your point of view of how you can approach a consultations.
It's good to see how a paediatrician works, how they think, the investigations that they're ordering when they get to see our patients. And it's also good to follow that patient through, from seeing them as a GP to where they all end up and the care that they're getting.
I think that's a great thing because the GP is a professional, it's great, but having the pediatrician that he's the expert with baby, they're working together. I think it's great for me, but it's great for the GP as well, I think, because they're learning.
We've given a structure, so one of the GPs I was working with today said before, if I had a child who was referred with problems at school, I'd just send them straight to the paediatrician. But now he said I've got a structure. I make sure their hearing is tested, their eyesight's tested, I look for certain things in their development and I can refer on to a speech therapist or occupational therapist if necessary. I'm doing standardised questionnaires to look at their focus and attention in the classroom, and I can put all that together and then make a decision as to whether or not they need a referral or this is something I can manage with the school and the family as well.
This program has allowed our patients to potentially be seen within a week, which is unheard of, that they could potentially be bulk billed, or they were bulk billed as a result of seeing their paediatrician, which was another great benefit, but also done within a local setting. So I think I think there are a lot of wins just for the community in participating in this project.
It's run a lot smoother than what I thought was going to happen. I think that there are a lot of question marks within the practice in terms of changes that would have to happen or how it would slot into the day-to-day running of the practice, but it seems to have slotted in quite seamlessly.
It's been very satisfying, and I hope the model gets rolled out further into the state and other clinics so that they can have the same experience that we've had.